Preventing vascular access device complications in home infusion therapy settings. So the abstract is vascular access devices are an essential part of home infusion therapy. While these devices are very important, there are several complications that can occur from using and caring for these devices. It is very important that employees fully understand how to maintain these devices as well as patients. This can lead to improved patient outcomes. Introduction. Vascular access device complications can be very serious and can lead to increased hospital stays. IV complications occur at a rate of 4 per second. Patients with vascular access devices can experience discomfort and pain, prolonged hospitalizations, extended use of antibiotic therapy, possible surgical intervention, and even death. The objectives. Precautions should be taken to prevent vascular access device complications. It is important that staff understand the complications that can occur. All staff involved with patient care should be routinely educated on how to properly care for the vascular access devices. Disinfection caps could be used on the ends of catheter hubs in order to ensure that the line stays disinfected. So the rationale for this project. Infection is a major concern in home healthcare settings. It is important to properly care for vascular access devices in order to prevent any complications. Vascular access device complications can significantly delay the patient's treatment. So you want these patients to start getting better, and then if they get an infection, it's just going to prolong their treatment and possibly make them have to be on several other antibiotics. The question for this project is, in home healthcare, patients with vascular access devices can requiring staff to complete staff education programs on the devices and implementing the use of disinfection caps compared to current practices decrease the incidence of catheter infections over 1 year? So this is the question we're hoping to address through the project. Evidence for change. In home healthcare settings, there are several different access devices that patients go home with, such as a peripheral IV, PICC line, or Portacath. Several complications can occur from improper techniques when using these devices. An infection can significantly delay the patient's progress. Here's pictures of the few vascular access devices. So we have the peripheral catheter, which is inserted in the patient's arm usually. They are for short-term use. There's the PICC line, peripherally inserted central catheter. They're for more longer-term use, and the Portacath, which is for long-term use as well. So the evidence for change. Vascular access complications are very costly and can lead to prolonged hospital stays. It is very costly to treat a catheter-related bloodstream infection. The cost can range from $6,000 to $50,000. Patients may require longer treatment if they develop any vascular access infection. So the recommendations. A sheet for the PICC line, the Portacath, and the peripheral IV should be made for each one of them and should be printed and provided to every nurse involved in the patient care so that there's a standardized care of how to take care of each of these devices. This ensures each nurse is educated on the proper procedure to maintain each of these vascular access device lines. Each nurse should be required to demonstrate to the charge nurse or director of nursing the proper technique of accessing and maintaining these vascular access devices during their new hire orientation as well as yearly. This will address any techniques the nurse may have developed that can increase the chance of infection, as well as ensure they have the proper technique to prevent complications. Disinfecting caps can also be implemented into the home infusion therapy setting. Often patients may not properly clean catheter hubs, which can lead to infection. The disinfection cap can be used on the end of the catheter hub to ensure the hub is properly cleaned prior to use. The cap covers the hub so that when the staff or patient is ready to connect tube into the catheter, and so that the whole process remains aseptic and it hasn't touched, the catheter hub hasn't touched anything before it's been disinfected. So here's a picture of the catheter hub. Usually it just it's got an antiseptic in there that it'll screw onto the end of the catheter hub, and it usually stays there until tubing is hooked up to it. Insurance recommendations. Ensuring staff are educated on the proper techniques to care for vascular access devices can lead to a decrease in access device complications. Implementing the use of disinfecting caps can limit the chances of infection by ensuring the catheter hub is properly disinfected. So, evaluation of the project. This project will require participation from all staff to ensure best practice is being implemented. Information should be provided to the staff in order to prepare them for change. After this change has been implemented for a year, information should be taken on the vascular access device complications and compared to previous years. So that way, this will show whether the change has been effective or not. Expected outcomes of the proposed project. With the change, patients will have fewer vascular access device complications. Staff will demonstrate proper technique in maintaining vascular access devices. There will be a decrease in the amount of infections caused by vascular access device complications. The conclusion is this project will be very beneficial in preventing vascular access device complications. It is important to make sure nurses are educated on the proper techniques when maintaining and accessing these lines, as well as implementing the techniques into practice. Also, patients and staff may not be compliant with thoroughly cleaning the catheter hubs. This can be addressed by implementing the use of disinfecting caps on the end of the catheter hubs. Thank you.